A new study is raising concerns about the emotional toll that active shooter drills can take on both students and staff. New at 5, Joe Henke talked to Georgia Tech researchers about a study that is believed to be a first of its kind.
The research team at Georgia Tech tells me around the country they noticed a drastic change in people's posts on social media after experiencing an active shooter drill at school, while other people living in those same communities that did not go through a drill didn't have the same changes in their posts. The group Everytown for Gun Safety published the study conducted by Georgia Tech researchers. Professor Munmun Deshadri with the College of Computing led the team. Postdoctoral fellow Mayal Sharif and PhD candidate Kashif Shah worked on the study.
People have been reporting that these drills are having a negative impact on their mental health. This was not empirically validated.
Deshadri says Everytown asked if scientific data could confirm or deny anecdotes of active shooter drills causing trauma. So her team analyzed nearly 28 million social media posts from Twitter and Reddit using a method called psycholinguistics. The posts came from people connected to 138 schools across 33 states where drills took place. By collecting millions of posts people posted on their own, the researchers say the study did not subject anyone to questions that may have re-traumatized someone or skewed results.
Stress, anxiety, depression can manifest in different ways, and using an unobtrusive method with collecting these data and kind of, as you mentioned, like it's a large data set, makes us very confident in our results.
The social media posts are from 90 days before and after an active shooter drill at a school. Deshadri says they found language signaling anxiety and depression increased, with words such as afraid, struggling, nervous, therapy, and suicidal appearing more frequently. The findings signaled anxiety and stress increasing 42% during the 90 days after a drill. Depression increased 39%, and posting health concerns and fears about death also spiked. Shah says he hopes the data can help guide policies and planning of future drills.
What could be done to address these kinds of mental health or psychological challenges that people may face out of these events?